Is there a way to ensure that before they meet you, that when they're in front of somebody who is going to do this procedure, that they can, is there a way to help them optimize? You mentioned there's things that you give them to help optimize their body, but what do they do when they're kind of faced with a conventional doc who may just be focused on surgery? They're not thinking about functional medicine. They're not thinking about coaching. They're not thinking about detoxing, any of these things, which may then make the procedure go well.
Yeah.
So kind of what do they do in that situation? Should they partner with a functional medicine doc, or, and just kind of try to optimize in that space as well while they're doing a procedure for an implant? How do we kind of give them hope that there's a way to, so that they won't even need you down the road?
Yeah. Yeah. So I think what I would do first and foremost is, and this is a food discussion, all day long for me. So I think it just starts with diet. And as a young person, when you have a really, really strong metabolism, you kind of will take a different tact. And so you may eat fast food, you may eat chips, whatever. And so I would say fundamentally, the things you can do on your own to help yourself are to eliminate gluten from your diet. So this will resolve one key inflammatory component that I see. And then I get a lot of criticism for eliminating dairy. But for obvious reasons, based on the supply of dairy and how it's, you know, processed in this country, we'll just say that. That is if you do those two things, you're already helping yourself a lot. The other like basic things are from Robert Lustig's book Metabolical, and you cut out, fructose and sucrose. So, orange juice, natural orange juice is not sweet, not to the degree that it is in any of the manufacturers because they've added things to it.
Of course.
So stop eating cereal for breakfast and having a glass of orange juice. So those things right away will just help you. And then basic supplementation, I would say for women especially, is and I always defer to liposomal things because I know that they'll absorb it. So the liquid based liposomal D3K2 is foundational. I think if we just want to assume that people don't methylate well, then a methylated B complex that's liposomal with trimethylglycine is important. A liposomal glutathione and a liposomal, we'll just say simple vitamin C. So those are just 4 supplements. They're liquid. You can take them every morning. They're not complicated. You will not get pill fatigue. They're not overwhelming. And you can take those and not suffer any dire consequences from too many B vitamins or anything like that. And then what I've added to our inflammation bundle to round that out is just glucarate and glycine. And so these are all like simple things. And just for everybody listening, like if you're going to embark on a journey to get surgery,